Welcome to VentureBlick Unboxing Day. My name is Janice. I'm from the VentureBlick Singapore office. Very, very happy to be here and hosting the session with you. Today's Unboxing Day is special. Actually, if you've been to a few of our unboxing days, you'll know that I always say that all the time, but it truly is special because we've got not 5, not 10, but 15 startups that are going to be pitching this evening. So I hope that you are not going to leave early because we're going to have a little bit of a competition here. To jazz things up a little bit, we want to be able to name one of the startups' best pitch today. And so with that, we have a panel of judges here who have, lent us their time and, kind of read through all the materials they've been provided about the startups. And then on top of that, we're going to get you to vote for the startups you feel convince you the most. So we want your participation as audience, not just to sit and listen, but to listen with the intent to vote for your favorite startup. All right? So let me just introduce our judges real quick because we want to get the pitches going. First up, we have Alfred Cheng. Alfred, can you just give them a wave so they can see your face? Yeah. All right. Round of applause for Alfred. Yes. So Alfred is from Roche. He actually leads the innovation at Roche Diagnostics APAC, involved in anything that you can think about relating to innovation. So he runs the innovation studio and even their open innovation platform called CreaSphere. Did I pronounce that right? CreaSphere. So it's startup CreaSphere. And he has a background in research and tech consulting. And is really passionate about driving collaborations when it comes to healthcare solutions. All right, next up we have is David. David right here. David, give a wave. Round of applause for David. Yes. So David is the Chief Operating Officer for DXD Hub and the co-lead for... actually, I just realized that I should be clicking through. There we go. Yeah, so David is the COO of DXD Hub and a co-lead at Digital Health Accelerator, which is under A-Star. He is really a tech executive, and he's really passionate about advancing digital health, and he's got a track record of helping digital health advance in companies like ST Engineering and GE. So very, very pleased to have David with us. And last but not least, the very tall, I think probably the tallest gentleman in the room. And I'm not sure how many, you must be tired of people saying that, but it's Dr. Faraz Mahdi. Give everyone a wave. Yeah, right. Yes. And so Faraz is a partner at LEK Consulting. He's got more than 20 years of experience advising medtech companies and governments on healthcare strategies. And he has a doctor there because he's a medical doctor, very passionate about mentoring startups. He actually ran one of the workshops as well that we have for this program. Before I introduce the fourth judge, I just wanted to give our guests give you a bit of a background of this program. So we are running this event today. It's actually part of the Global Market Immersion Program, which is actually sponsored by an organization under the Korean government. So we're kind of privileged to have been selected to be part of this. And we're doing this in partnership with KSPO. So earlier on, if I can just quickly go back, you see the 4 logos there? Those are the organizations that we're working with to make this event happen. Last but not least is Chris, founder and CEO of VentureBlick. He's our 4th judge for this evening. And before I introduce the first startup, I'm going to give Chris a little bit of time to say an official welcome to everyone. Chris, short welcome. All right.
Good evening, everyone. I need a better looking photo.
Oh, yeah.
Anyway, I'm one of the tallest Asian person because he's always tall. But anyway, she reminded me a few times that I need to hurry up. I cannot go into usual 30 minutes on and on about our company and all that. So I skipped that, and just wanted to appreciate you guys coming here despite Friday, late afternoon, early evening. I'm sure you guys are very tired. A lot of other events are going on, but we try to make the event more impactful, but only thing we can do as a company is to help them to present better in terms of creating a setting. But the actual product and services innovations are from the company, although these are all Korea-originated country product and companies, which is my home country. I have to say I was quite impressed with the quality and the innovation that are taking place here. And some, I admit that they're quite early, But I was speaking to some of you because we have a quite number of investors here and some academias and healthcare community decision makers. But try to pay attention to some of these companies because I do feel that some of them are about to, build something quite meaningful. But I think I've said this before in some other settings. Healthcare innovation to make a company from inception of the idea into something commercially successful to exit, to offer benefit to all these people that I need takes more than a village. So we need to support them so that they can actually grow. So at the end of the day, we can all get the benefit. So I'm just trying to stay official instead of singing and dancing and everything else. So again, I just wanted to welcome everyone and appreciate the fact that this is a Friday, early evening that you guys are joining us, and that we have a 15 company to present. Unfortunately, we don't have. I wish we have hours to present these companies, but they were only given 4 minutes each. Yeah, even 4 minutes each times 15, that's like 1 hour. So please pay attention that you will be asked to judge one way or another. So give us your judgment so we can actually help them together to grow. And then I also wanted to thank the Korean government who's sponsoring this event to get to where we are. Although there are 4 different organizations, but the KISET and then the KSPO is the one that are main sponsors behind, but I don't want to give any pressure, but we do have a lady representing KSPO there, so would you
Give
like
us
to...
a wave, Sujin, all the way from Korea.
She actually flew in all the way from Korea. I thought that she came here to inspect us, but anyway, she came here to support us. Yeah.
Make sure we're doing
So anyway, this is quite meaningful, especially for a lot of the startup companies. So even if some of them may not be meeting your expectation, but we expect you to give them the encouragement and the courage so that they can improve it next time. But there are some hidden gems here that we should be paying attention. So
Yes,
again, we can only do it to help them to go better global with your support. So with that, I'll just stop here, and please stay till the end, and then wait for who gets the more
Best
credit
pitch,
recognition later on. And then after that, there's a small networking session where you can spend a little bit more time as well. And then next Monday at the Switch event, we do have a VentureBlick pavilion where we have 11 of 15 companies representing their own booths within VentureBlick pavilion. So if you can stop by there to give us a support and any question, that will be appreciated. Yeah? Thank you. Yeah.
Thank you very much, Chris. Round of applause for him. All right, before I invite the first startup, so if you've just joined us, welcome to VentureBlick Unboxing Day. Tonight, we're going to be hearing from 15 startups from Korea. I just want to stress that they're not in their home country, so you can imagine what it's like to travel to a foreign place and to pitch. From what I've heard, it's not only their second language, for some of them, it's their third language. So I hope that you can join me in giving them all the support that you can. Do you think you can do that? Yes? All right, okay, fantastic. That is already warms it up. I think we don't want to make the stage kind of like, too cold and daunting for them. Now, if you want to, throughout this whole evening, we've produced this wonderful booklet. It's got information about the 15 startups. So please flip through it. If you have any questions during the networking session later, please go and approach them. They're situated at different parts of this venue. And speaking of venue, I also want to say thanks to the AWS team for allowing us to use this space. All right, so shall we get the show on the road? The first startup, the first one is always the most nervous, but we can give her some support, right? All right, yeah, very good. All right, okay. So our first startup is Medi AI Plus, and one more round of applause, please. Yeah, okay, good. All right, Yohi, you've got 4 minutes. The time is yours. Go ahead.
Good evening, everyone. I'm Soi Kim, Business Development Manager in Medi AI Plus. So, what causes a loss of $8 million for each day of delay? I'll give you the answer. Each day of delay in clinical trial can cause loss between $600,000 to $8 million. This delay increase costs and make it harder for patients to get treatment on time. So to reduce this loss, choosing the right contract research organization or CRO is crucial, is essential. CROs are meant to help streamline clinical trial, but finding the right one is the crucial steps that can affect trial success. So we have to think carefully about this. Each CRO specializes in different area, but there is no comprehensive database for CROs worldwide. That means manual due diligence is required for each CRO, leading to inefficient and slow shortlisting process that delays clinical trial timelines. To solve this, we developed solution, FICRO, the largest clinical trial database. So our AI evaluates over 3,800 CRO, considering more than 20 different factors to provide best match for your clinical trial needs. So by standardizing and cleansing clinical trial data, we ensure credibility and efficiency. So we monetize our sponsors' time by providing a list of recommended CRO, personalized to their clinical trial needs. And meanwhile, CRO gain greater visibility and access to standardized information. And the best part is this platform is free for CRO to use, making them easier to connect with their potential clients. There are similar services out there, but FICRO offers broader data coverage and competitive pricing and a convenience of AI-powered platform. So we compile data on more than 680,000 clinical trial and 3,800 CRO data on our platform, and we generated $1 million in revenue. Our team consists of experienced professionals with diverse background in drug development, clinical trial, and AI specialists. We are currently in the process of raising $2 million in pre-Series A, with 0.5 already committed. Our roadmap involves further development of our clinical trial search system, and by 2027, we aim to add the service for recruiting patients for clinical trials. Thank you for listening, and we look forward to partnering with you to bring innovation in clinical trial process and involve better outcomes for patients. Thank you so much.
Thank you. Round of applause for Siohee. Just stay there. I think we have time for maybe 1 or 2 questions from the judges. Who wants to go first? I see a hand there. Yeah, go ahead.
Very good presentation. May I ask you, how much are you saving the company's time? How much does that decision-making take?
Average day, it takes like 6 months or 6 months to 12 months. But when the medical device company asked us to use this platform, and they found their CRO in Australia for 12 days. Wow. So we can reduce like average in 94% reduce.
Great. I think we have time for 1 more question. Yeah. Any other judges? Yep.
Can you share with us like the 3,800 organizations that you mentioned? How's the spread across the globe? So in APAC, in Europe, and North America.
Right now we have 70% of domestic in Korea and 30% of cross-border.
All right. Okay, great. Round of applause for Siohee, the first presenter. Thank you so much. Okay, next up we have a duo, actually. Give it up for Dr. Cho. Round of applause for him.
Hello, everyone. I'm Sang-Gujo, Professor and CEO of STEM Exxon. Our company to improve the quality of life of humans and pets. So we use stem cells. So the stem cell have a good therapeutic effect. But the stem cell also have some limitations. But the exosome, the stem cells secrete lots of exosomes. So exosomes are the messengers that deliver the therapeutic factors of stem cell. So that is the better therapeutic. And we developed some special techniques to produce lots of the stem exon exosomes. It's about 10 times higher exosome production and 6 times higher cell absorption rate. So also our exosome contains lots of the therapeutic stem cell factors. So our technique is much better therapeutic. So our stem cell showed our exosome showed the excellent production and internalization into target cells, and also have a very excellent anti-inflammatory and regenerative capacity, and published in high-impact journal and got the patent. So at first we tried to develop the therapeutics with our stem exosomes. So we confirmed the efficacy for the inflammation pain diseases, and also for osteoarthritis, and also for neuropathic pain treatment, and also to show very high effect on the atopic dermatitis, and also psoriasis showed very good effect on psoriasis treatment, and showed very good wound healing capacity. So for fast commercialization, we developed the animal medical devices. So in collaboration with the licensed medicals, we use the target cool, and then we, this is our exosome, brand name is Bexohil. So we got the much better therapeutic effect. This is before and after. We showed very dramatic healing effect. So this is our exosome. So this is the exosome is a rapid frozen, and this kind of particle delivered into the skin, like this. So now we developed the pet skin disease medicines, and also for faster commercialization, we produce the cosmetics and skin boosters. This is the stem 1 alpha cosmetics, and also we produce the skin and hair booster. This is cosmetics stem 1 alpha, contains stem cell exosome and also porphyrin, which is known as the plant Botox. This is a skin and hair booster, contains stem cell factors, exosome, and also PDRN. Okay, so we expect this kind of increase of sales, and we have a good Korean partners like this. Now I'm here in Singapore. Now we are much better therapeutic, but try to expand to best with more global partners. So we try to make this kind of big increase of sales with more global partners and investors. That's why I'm here. Okay, thank you very much for your attention.
Thank you, Dr. Cho. Could I get any of the judges want to ask a question to Dr. Cho? Anyone interested? Oh, maybe no.
Yeah, this, at least to me, because I don't have the expertise here, but looks like some cosmetic and aesthetic field to it. So main target is it B2B or B2C, or is you are targeting both? Which segment are you focusing more?
Both. So I try to find the good partners so they can the B2B, and also in our company we have a partner, so they can have the department store, so we can also have the B2C, okay, and B2B and B2C.
So this could be positioned as a sort of a medically focused cosmetic
Yeah, for the
aesthetic type,
cosmetics,
yeah.
the sales, the focusing on the boosters
Right.
with the doctors.
Yeah,
Okay.
Then China should be a huge market, right?
Yeah, right. Japan, China, many Asian countries. Yeah.
And Dr. Ferris, yeah, you had a question.
Just on the stem cell technology side, any challenges you face in terms of regulations when you're trying to enter these many markets?
Yeah. So that's why we are trying to develop the therapeutics. It takes a so long time, but at first we developed the cosmetics. Very they have a very good quality. So we can sell, and the boosters there is also like the cosmetics. So we can sell to the customers and directly or through the doctors. So in Korea, Japan have a good regulation. So now the Korea also changing, and the Taipei also have very good progress. So I think the Asian countries may be the very good choice for the expansion of the market.
Okay, great, thank you very much, Dr. Cho. Thank you. Yeah, applause for him. Alrighty, if you've just joined us, you haven't missed that much. We've got 15 startups pitching today, and you've just completed the second one. So the third one is the lady with the brightest hair in the room. Let me just get you a mic. There we go. Right, round of applause for Go On Joe, please. Yes.
Hello everyone, this is Udang Network. So today I'm happy to introduce our personalized skincare service named Head for sensitive skin. This is atopic dermatitis, which affects 20% of children and 10% of adults globally. The patients suffer from various levels of severity for entire life. So even in the better condition, they need continuous care on beauty side as well. Atopy can cause not just physical discomfort, but also emotional stress and lower self-esteem. So addressing this skin issue is not just skincare, it's about the improving whole life quality. This is how Head works. With just a single photo, it can address whether the skin condition is atopy or not, and then suggest the personalized recommendation. And we are in process to partnering with another AI model, licensing another AI model for Head. So in medical side, we diagnose the atopy severity and recommend to visit doctor or products to relieve the symptoms. And on beauty side, through the collected time series data, we predict the skin condition and then suggest the personalized care for improving skin health. And what is our strength is, we provide the personalized skin report. In Korea, we already done with the first phase with Head Beta program. And as you can see, we provide the skin condition changes and recommendation of the products with full product ingredients with matching rates to user skin. And end of last year, we did test with 1,000 people, and we could see the 38% of reduction of total exploration time for skin condition treatment. And since Head launching, we gathered the 10,000 users, and 2,000 units of in-house products have been sold. So that is our own podcast contents, handling with not just skin health, the topic for general health care. This year, we aim to 0.4 million US dollar in Korean B2C market, and we are planning to expand into ASEAN market on B2, B2C operating, targeting 3 million USD. And we will expand into North America in 2026. So we already have Singapore entity, and our team consists of experts. For example, our CEO, Dr. Lim, who has PhD in medicine, and Dr. Ha, head of the dermatology department, Gangwon National University Hospital, and Dr. Sheng as a local expert and co-founder. So HeadUp is not just a skincare app, it's a comprehensive data-driven platform. So we are seeking for strategic partner and investors go to global market. So thank you for your attention.
Thank you very much, Kwon. All right, I think we have maybe time for just one question. Yep. All right. Here you go, David.
I noticed that in the US, North America, you're looking at hospitals.
Yes.
So moving from B to C to B to H, as you say. Do you see a product being used as a medical device for diagnostic purposes? And how do you address that from a regulatory perspective?
As I've mentioned, we are process in partnering to licensing the AI model with that made by a doctor, dermatologist doctor. He has a patient image data now these days, so we can improve this device and platform to B2H market. Yeah.
Thank you.
Any more questions from the judges for Kwon? Yes, Alfred. Okay. Last question.
Just wondering, in terms of the database that you mentioned, do they have a good representation of different skin tones, different population, or is it predominantly Asian or Korean population data that you have?
Actually, now we have only data about Asian people, and we developed a model, Korean, as well as Korean model and Korean skin type and Singaporean patient's skin. Yeah.
Okay, all right, great. Thank you for your questions, judges. Thank you to Ms. Jo. All right, next up, he's the only presenter who's not Korean, right? Someone from our home country, Nathan Cheong. Go for it, Nathan.
Thank you for
4
that.
minutes starts now.
All right. So I'd just like to start by asking you what it will be like for our children and our future generation to be worry-free in their health, especially when they hit 50s and the 60s. Right? So Singapore has started with this paradigm shift into preventive healthcare, but the only thing that worries us is the current market. About 99% of all digital healthcare services, they are found within the aging population. So in the thought of preventative healthcare, why are we not starting it early? I'm Nathan, this is Injomi, and I would just like to share with you how AI prediction can help with preventative healthcare in child and adolescent health. Now, with our current AI model, we have outperformed all other models that is in healthcare by collecting health data, and I'll share a little bit more in detail later. We have achieved up to 88% accuracy with just 10 weeks of data collected within our POC target group. This then is brought into attention by IEEE Journal for Healthcare, Biometrics, and Information as a highlight in 2024. Now, the way we gather this data consistently is through a gamified platform for our child users, and this is to ensure that they give us consistent time series data. Now, this data is then given to the parents and even offline services such as medical professionals through AI processing and AI prediction. That also helped us achieve an improve in BMI for our Korean users for 10% of them. Now, with our proven AI solutions for obesity care, we are currently working with Jeju local governance, Samsung Health, followed by Save the Children. For our Mind Care service, we are working with IMH, NHG, and National Healthcare Group. And for the various AI engines, we are currently in talks with local polyclinics and General Electrics. As for our validations, we have done our due diligence, covering all the different IPs, journal researchers, and different IRBs. As this is almost an empty market, we are also looking to expand to hit all the total addressable market, by expanding our serviceable age group and different various services to provide for them to cover the wide expanse of different healthcare issues that they might have. To drive this, we have 3 different specialists as leaders. Firstly, our CEO for business strategy, gamification, and most importantly, the AI lead for R&D. Now, for today, we are looking to fund our growth, and most of what we're looking at is to expand within the Asian market. So I'd just like to invite everyone here who is interested to find out more, come speak with us, and I will be happy to answer any questions. Thank you.
All right, thanks, Nathan. First judge to ask a question, Chris.
Yeah, I've got one question, but before that, you started by commenting what would happen if you reach age 50, but by the way, age 50 is actually very young, so you should, next time you should use 80, 70 or 80, not 50, yeah? But anyway,
Yeah.
my question is, you also mentioned about your product with the accuracy rate of 88%,
Yep.
but I'm not sure because I don't have a medical background, but 88% doesn't seem to be good enough in a field of medical. It should be a lot higher, but I assume you have some kind of a clinical backing of your claim of 88% accuracy. So how do you verify that that is actually correct?
So with the 88% accuracy rate, it is based on how well the information is being collected and predicted to give them a better trajectory towards their health goals. So that is just with 10 weeks of data, and based on what the CEO have shared with me, up to now we have hit about 99% based on just the 10-week data. So we're constantly improving the AI model as we go.
All right, great. Thank you very much, Nathan. I think that's all the time we have for this one. All right, yep, to me. Great, thank you, well done. All right, next up, if you've just joined us, we have 15 startups pitching today. I think there's already 4, if I'm not mistaken, that have pitched, or is it 5? And they are actually not just from healthcare. The startups pitching tonight are actually there are 4 startups from sports as well, sports innovation. So next up is Young Jae Young. Yep. Give him a round of applause, Jae Young.
Hello, thank you for having me. My name is Jae-young Yang, and I'm marketing director of 76Soft. 76Soft is IT software company, operates Wekook Live service, which is tournament management solution for badminton. Let me show you how human error makes sports difficult. Oh, the sound doesn't work, okay. But you guys can understand, right? Okay. Yeah. It's okay. It's okay. Go on. Oh yeah. Okay. Okay. We are while the sports game, there's so much human error, like compute the score, and what would it be like to run 100 games at once? So we developed a big group live. We tried to preoccupy the market, and because we know the sports game organizer have suffered by high level of this kind of inefficiency. Why badminton? Badminton is #1 racket sports in Korea, and however, it's still a really analog, and I think it's quite scalable market, such as tennis and table tennis has a similar game pattern. So we try to digital transform all the steps of tournament. Let me show you how Wake-up Live.
We're going to assist him with the audio here, so please bear with us. Yep, let's try. Yes.
Yes.
Wake-up Live is a tournament management solution. We give all umpires a tablet connected to the command control center. During a game, umpire checks the player's name and touch the screen to start the scoreboard program. This replaces traditional folding scoreboard. The game score can be counted by touching the screen, and the data will be sent instantly to the server. When there is an urgent situation, umpire can quickly alert the organizer. This application shows the whole tournament in real time, and there is also a live chat function with the organizer. Wake-up Live makes tournament easy to control. You can download it iOS and iOS App Store.
Okay, so we've made a progress so far. Like this year we operate 85% of tournaments in Seoul, and the numbers who experienced Weekend Live is 500,000. Only restricting Korean. Okay, and those are the feedback explaining why our retention rate is high. We are, yeah, we are trying to become a platform. So this is how we want to go.
Okay, great.
Thank you so much.
Thank you. Any questions from the judges? Yes. All right, Ferris and then David.
85% of all tournaments, is it like with one giant organizer or a national organizer that you were able to get this dominance?
Include all the tournament in the Seoul in Seoul area. Yeah, there's a 55 tournament as a national tournament. So actually this year we handle like more than 45 tournaments in Seoul.
I assume this is AI application that you guys have built?
Not yet, but we try.
What's the model accuracy of the technology? I mean, in healthcare, you know, if the model's wrong, maybe the patient dies, but this is really serious, right? If you get the badminton call wrong, it's a big deal, right? You ready to replace human judges?
Oh, yeah. For badminton, it's not this serious, but yeah, it's based on like we have lots of data, previous game, and there's like similar person, and then act like 170 centimeter tall, and he wins when win the game a previous game, and then there are approximately like 35% he may win the game next game, like this. We have lots of data.
Analytics. Super cool. Thank you.
Thank you.
Cool, thank you very much, Mr. Yang. All right. Okay, so now if you, we just want to, I think we have finished like 5 or 6 startups. We've got a few more to go. I just want to really ask you to give them your attention. I know that you really want to catch up with each other, but you know, they've practiced really hard to pitch to you. So maybe speak in hushed tones, or maybe take it outside if you don't mind, so that, you know, we can give them our undivided attention for just 4 minutes. And also you'll get a chance to vote for them. So hope that you can support them by listening. Alrighty, next up we have Jiwan Bang, who's going to tell us about Moti. All the best. Go for it.
Okay. Hello, I'm Jiwan Bang from Moti. It's an honor to introduce our product, Smart Exercise Machine. Do you know Real Madrid? Moti is one of the startups selected by Real Madrid. And we will collaborate with them to POC, include training session. Problem of the traditional fitness market is the space limitation, high cost, and inconsistency. So suggested our product is Smart Exercise Machine, which digitalized strength training based on advanced motor control technology. For our design, even a small space, we can use multiple cable exercise, even like a conventional cable machine. Not only just using a motor generating constant load, we can make 6 different type exercise mode and provide functional training. After workout session, all of workout data gets saved and analyzed, and this data is used to generate efficient workout planning. We offer 3 different interfaces. First of all, tablet app is control the product and get data. Second, personal mobile app for user is review the data and history. Third interface is web page for trainer. Trainer can help to managing center and review all of client information. Our focusing customer is PT shop and Pilates studio and corporate wellness space. We are the not only first startup using a motor, but our approach is unique. We are the only helping PT center with client management and center operation. We haven't officially launched yet. We are meeting with many potential customers and sold 10 pieces already, and just 1 set is located in VentureBlick office. If you want to see our product, come. Moti is started from 2023 LG in-house venture program, and our member is organized expert from various fields. Thank you for listening.
Thank you, Jiwan. Any questions from the judges? Yes, Alfred has one. It's true.
Please slowly.
The VentureBlick office is actually turning into a corporate wellness space. We do have the machine there. You can go and work out and join the next Physical 100. Okay, go ahead, Alfred.
So you have the physical machine that I assume you're selling for a price, but then for the analytics, do you charge a subscription for that? How do you monetize the service?
repeat, please.
Yes, maybe I could invite my colleague Jennifer to maybe help to translate. Yeah, if you could.
Right.
Do you want to repeat your question and then she can help?
So for the software device and analytics, how do you monetize that? Do you have an additional fee? Is it subscription based? How is it?
오케이. 어느 정도 이해했어요. Base business model is selling the model, and we are collecting user. Our service is provide this app. Our personal app service the personalized PT service and predict your body future, and training app can customer managing. We can subscribe price model.
Subscription model. Okay, got it. Subscription model. Okay, maybe yes, David.
Thanks for your presentation. So if I'm a gym owner or a corporate fitness center owner, can you tell me very simply why I should buy your technology versus any number of different solutions already out there?
Okay. Our focusing country is Korea, Singapore, Hong Kong, Japan. This country same. Sorry.
It's okay.
This country is the same. Common thing is landscape very small, and people income is very high. So landscape efficiency is very important. Our product is just one product can do many things. Exercise can possible. If we want to more information, our product using guide is uploaded than YouTube. So this machine is very efficient landscape, and trainer can managing all of client in digitally, not analog.
Not in analog. Okay.
Okay.
I hope
thank
that
you.
clarifies the question, answers the question a little bit. But we do have to move on. So please give a round of applause to Jiwan Bang. Yes, thank you. Thank you, and thank you, Jennifer, for being on standby. All right, next up is something to do with dentistry and aesthetics. So give it up for Lina An. I like how you style. Thank you. I like how you style a T-shirt. Yeah.
Okay. Hi, this is me before and after thread lifting treatment. Beauty industry and facial aesthetics industry is growing very fast globally. This is due to increasing disposable income, especially in emerging markets, and also due to exposure to social media. And I believe that because I have benefited from this, and people should have access to this kind of treatments and benefit from this too, anywhere in the world. But did you know that doctors are actually not trained on how to do thread lift in school, or Botox, or fillers? Where do they learn? How do they learn? Well, some doctors actually self-teach themselves by watching videos on YouTube, and some doctors learn from their peers or their mentors, or they enroll for private classes. So Korea is actually leading this aesthetic industry in Asia. So we are providing a training from Korea via our platform to doctors. By doing this, we can reduce time and money for doctors to get trained from Korea. Instead of traveling all the way to Korea, they can learn from us anywhere, anytime. We do this by providing on and offline courses, vetted product marketplace, and also peer learning from our community. We can actually reduce time for doctors by up to 40% on training, and also cost up to about 80% as well. So how it works? Doctors can learn on our platform, then using our products, they can apply clinically and then share the cases on our platform. This is all powered by a patented reward-based system. so that they get locked into our ecosystem as well. This is our business model. B2C sales of courses and products, commission upon sales of products, because we are bridging companies with our dentists or doctors on our platform, and ad space. But with growth of our community, we can actually expand our business model vertically in the future. We have chosen India as our first pilot market because due to geographical barriers, there's a huge gap in terms of clinical training opportunities, despite of increasing demand in market. This is our achievement in just 5 days from India. We have 500 dentists on our platform, and we plan to expand even further and faster with territorial expansion. We aim to have 2,000 doctors from India, just from tier 1 cities, but we can grow even faster when we expand the territory simultaneously to other cities in India, but also if we increase the territory by other markets, we can grow even faster as well. And this is our 3-year forecast based on sales revenue forecast, just in India only. So if you think about it, like if you expand to other markets simultaneously, then we can grow even faster. We're the only integrated platform specialized in facial aesthetics and dental. We're a team of experts from healthcare and dental backgrounds. So we have raised $240K, Singapore dollars, till date, and we're raising next series round early next year. Our aim is to save time and money for doctors to upskill themselves to provide facial aesthetics and dental procedures to their patients. And we aim to do this by providing courses from Korea, increasing accessibility to quality training and products from Korea across Asia. Thank you.
Thank you, Lina. All right. Hold on, we can have questions from the judges. Yes, who wants to go first? Anyone has a question? Yes, please.
Is there any certification needed, just from a regulatory point of
No,
view?
surprisingly, well, it varies from country to country. So where we're focusing right now in India, or even in Korea, anyone, as long as you have license as a doctor or dentist, you don't need like officer certificate, but even if you just like self-teach yourself, you can do it, surprisingly. But it varies from country to country. I mean, Singapore is very regulated.
Right. Thanks, Ferris. One more from the judges or not? Got everything you need? All right, then we move on. Thank you, Lina. Round of applause for her. Thanks so much. Thank you. Okay, good news is that we're at the halfway mark. So we already have, I think, 7 more startups, and the next one is it this one? Martin from Young N. Round of applause for Martin, encourage him. Yeah.
Hello guys, I'm Martin from Young N, and we developed an AI solution to prevent the dementia. So I'm not gonna say like aging population issues, something else like blah, blah, blah. There is like many software out there, like digital software, like in targeting seniors, but they don't really, forget about the important issues. Like seniors have big challenges using the technologies. Like you guys have to go to some special place to use it, or like most only have like touch and drag single task training, and also like it's not effective enough. And also like you have to do regularly, but it can't. So that's why I built the Brain Health Playground, which offer like funny games, like, and also like how to say, like personalized content to like do enjoyable. So what makes us special? It's easy to set up at home and like providing effective dual tasking training, and also like we have a like built-in system for checking progress as well. And also, we built the algorithms to utilize the biometric data, such as motion, voice, and facial recognition. And it helps us to generate the reports like on how well the seniors is doing, or we can it helps to spot the early sign of a problem, like by comparing the abnormal and normal groups. And here's key examples of our products. You guys can rent it and easily install at home, like connect to the TV or like monitor at home and just start it right away. And we've completed the initial research in Korea, and also now we are running a clinical trial in Korea as well. Our business model is B2B2C. Like we partner with the care center to provide, integrate the services with our solutions. And the great thing is that the most cost for the senior is supported by the supported fund in many countries like Korea and even Singapore. And here is all the tractions from our side. Like we've launched it in about 10 care centers, and the feedback has been really positive. And the data shows us like a senior is using it actively, which means we have like a lot of room to grow. And we're since we started in 2020, we are in seed stage right now, and I'm so happy to connect the global partners or like investors who can like help us grow in next funding round. Here's our team, and like we like ensuring we have like skills and the knowledge to move our business forward. So Youngin create the solution that is really easier for seniors, and I hope to see partners and investors to help us grow and reach more people. Thank you.
Thank you, Martin. Well done. All right. Who would like to ask a question from the judges? Anyone? Yes? Our presentation was very clear. Oh, Chris? Yes, thanks, Chris. Go ahead.
You already have some revenue that are being generated with this product, yeah? Is that correct?
Oh, just few revenues.
Right. Only from Korea or?
Only from Korea.
So you're only focusing on Korea or any other markets? Or?
Right now, we are focusing on Korea, but since I've been here in Singapore, we are looking for like partners like for the commercializations to like expansion globally.
Okay, great. Thank you very much, Martin. Round of applause for him. Thank you. All right, next up we have Lady Innovator. From Molim, Sora Lee. Please, round of applause for her. Yes, thank you. Take it away.
Good evening. I'm Sora Lee, and today I will introduce Molim INC. Molim is from the word molecular imaging. We are providing confidence in drug development to success with visionary evidence. One day, our founder, Dr. Hyun-Suk Park, when he was a researcher, he saw lots of his colleagues have had a problem with the new drug development. He knew the nuclear medicine, molecular imaging can solve this problem. So he has established the Molim INC to help more researchers succeed with better data. The traditional methods are slow and expensive. It takes 10 to 50 years, but you can get only one result. That's not unfair. And also, the conventional method needs lots of samples, and that samples cause lots of human errors, lots of high variability. And then also you can get the indirect data. But nuclear medicine molecular imaging can show PK and PD immediately. And also use less samples, and also get the data from the same object. Molim also has 3 advantages. And our CAMPATS can provide the customized protocol with the wide range radioisotopes for the drug candidate. Also, we use high-tech equipment at the Seoul National University Bundang Hospital. Also, our over 20 years experienced experts can provide not only just data, but also actionable conclusion to make a better decision for our clients. These are similar service providers in the world, but the nuclear medicine is too difficult, so there are only 5 companies in the world. And only Molim can service all the service stages, and only Molim can use a wide range of the radioisotopes. Our team led by Dr. Hyun-Suk Park, who is a PhD in nuclear medicine. And also we have lots of experts in each part. When we have established in 2022, but over 18 Korean top research labs are already using our service. That means market highly need nuclear medicine molecular imaging. And from this quarter, we are starting to expand our market to Europe and Asia with this program. So we expect our revenue growth is rapidly increasing by the next year. If you are wondering, want to go in the new drug development, be partner with us. We can save your time and money with our nuclear medicine molecular imaging. Thank you.
Thank you, Sarah. All right. Any questions from the judges? Yes. David first and then Alfred. Yes.
Thank you for the presentation. Will you say that you're a technology company or a service company?
We are service.
So service, and so how do you intend to scale to other markets with this service? Like if you go to Europe or other countries?
I've known that there are lots of new drug development company in Europe and Asia, like China and India. So we are going to service the preclinical and the clinical service with the nuclear medicine molecular imaging.
Okay, so they would send their data to your office in Korea.
Yeah, okay. And also we can go to the market.
Very clear, thank you.
Thank you very much, David. Alfred, you had a question? No? Oh, same question. All right, telepathy. All right, thank you very much, Sora.
Thank you.
Yes. All righty. Okay, next up. Yes. Could you help me advance the slide? We're journeying on with On Journey. Round of applause for Mr. Lee, please. Thank you.
Hello, everyone. I'm Mr. Lee, CEO of On Journey. Let me explain integrated platform for diabetic management through nutrition and insulin control. This is my parents. My parents has diabetes. Especially my parents doesn't know how to manage diabetes. Especially my dad has a habit to take medicine and insulin on time, as prescribed by doctor monthly. Several times he fall down by taking insulin on time according to the prescription, without eating and regardless of his physical conditions. My parents gave me not only diabetes, not only love, but also diabetes. I also become a diabetes. After that, I felt my parents' pain too much. I also fall down several times because I took medicine and then after without eating and then exercise a lot at gym. That was a hypoglycemic shock. It was a really dangerous experience for me. Diabetes is hard to managing as a chronic disease until death. It is very difficult to self-determine the right number of daily insulin and medication. Many companies are doing a service for health habit, but every functions are scattered, such as diet and nutrition, exercise, sleep. We prepared two kinds of solutions to solve this problem. First one is a diabetic disease AI coaching solution PICKIT. Our PICKIT can recommend the personalized health diet and exercise step of work based on daily health habit data such as health, nutrition, diet, exercise, and medication. We also can recommend daily insulin dosage based on each person's health status with optimal preference AI technology, collaborative filtering, and generative AI algorithm. And also, second, we prepared the solution is a diabetic drug delivery solution PICPen. PICPen is a one-touch level piston-structured pen injector with a hidden needle. Compared with other competitor, our PICKIT is an integrated solution with our own medical solution PICPen, having user-friendly UI and having wide coverage, not only wellness by recommending diet and exercise, but also illness by recommending amount of insulin. And also we have a better accuracy, over 80% based on AUC, AI. Our company already made a platform and medical device PICPen. Maybe next year we will make interconnection with medical device BGM and CGM. We will make a CGM and insulin patch next year based on our original technology. Onjoni is currently initial capital is over 1 million. Last year we already got the revenue 630,000. This year we are target 1.5 million. Now we are seeking 2 million as a pre-series A funding. We have a broad and deep experience in digital health care, and we have a teamwork with 16 members, including doctor and nurse. We hope guarantee beautiful and healthy life with extended lifespan to human. Thank you so much.
Thank you very much, Dr. Lee and Rich. Yes. All right, first up from Paris.
Thank you for the presentation. I didn't see in the competition any of the established continuous glucose monitors from Abbott, like Freestyle Libre and others. Why aren't they not your competition and you chose the other apps?
Other app usually is recommend is food or is a diet based on the user's selection. That's all. Based on that is AI. But our that means they just focus on the product that somebody select. But we focus on the person itself. It means hyper-personalized, we say. Because after we just questionnaire, maybe 15, after that we can make your taste map and health map based on. That's why we can calculate what position you are. That is different.
Any other questions for Mr. Lee? No? If not, let's give him a round of applause and invite the next presenter. Yep. All right, let's do. Okay, next up from Remo is Yun Kyung Bae. I hope that I pronounced your name right. Give her a hand, please. All right. Yes.
Hello everyone, my name is Eun-kyung Bae. I'm the CEO of the Remo. Everyone wants to make the after body shape, but being like the body, having a their body shape is needed a lot of effort and time. And Remo, we provide AI powered tool that can help to manage your health. I'm originally biomedical engineer, and I worked in the Assam Medical Hospital. And at there, I met my co-founders, and we developed the Remo and this solution. Next. Yeah, all fitness center and trainers need to strengthen their competitiveness. Many customers, most of customers demand for health data-driven management. So they bought the InBody. InBody is one of popular tool to analyze their body components, but they cannot analyze the vision-based information. So the trainers buy another product named the 3D Body Motion Analyzer, like that big size machine. But there is some limitation. As you've seen, it's a big, and it takes a little long time and high cost, and because it's a hardware, big hardware. And there is a accuracy issue because they're using a depth camera, and there is a lack of industrial specific movement solution. So many trainers just using like a traditional way, just take a picture of their client and checking their customer's body condition. I introduced our solution named the FineFit. FineFit is the fastest and simplest 3D body posture and motion analysis. We are an AI company, and we truly focus on getting a precise 3D body and 3D motion analysis using a general camera, adapted the latest AI technique. And we provide better usability and also hardware flexibility because we're using a general camera, so it's a mobile product. And we're expanding partnership through providing our API service. This is the main function of our FineFit kiosk. Simply taking a front and side picture, we can get a body posture, and also we can get a body size. And also there is a complex dynamic movement test. Either taking a single video, then it's automatically calculated by AI. And also we have a future prediction function to motivate your client. And also we have a Chinese English version and master website. We launched this FineFit last year, and FineFit sold in over 100 stores in Korea. We focus on a smaller fitness center. We have a technology to extract the 3D body posture and shape from the single video. So we diversify our product and AI technology from the fitness center and the medical use. In the fitness center, there's a FineFit, so it's for the simple, it's a small fitness center. And in the medical use, we have a Remo Body S. It is a 3D gait analysis. And this is our business model. We also selling our API model. We extend market from the starting of Taiwan, and we extend the market on the Singapore. And next year we want to go to USA. This is our market. And 2 months ago we finished the seed round, and next year we try to preparing the pre-series A. Yeah, the Remo means the recover your body movement. We are focusing on, we are make a better posture, and we want to make a better body balance. We're looking for a partner and investor in Korea, in Singapore, sorry.
Thank you, Ms. Bae. All right, so any questions from the judges other than how to get abs? Yeah. That's I think, what's the mic? Right here, okay, yeah, go ahead.
Yeah, I definitely want to use the future prediction, but I'll put it on my as today. But with body composition, the big question is VAT, right? Visceral adipose tissue, subcutaneous fat, especially in Asia, where we have a large skinny fat population.
That's right.
Can your technology estimate or capture this? And how does it compare to like MRI or DEXA?
Oh, yeah, good question. Actually, we tested our technology comparing to traditional motion capture system because it is a gold standard of our technology. But as you said, we need some clinical trial with the doctor to check the DEXA and MRI to check their bone posture similar to ours. It's some of our next task. And actually, we also get some data from very thin fat. I mean, you said some is very slim, but some girl has some fat. Yeah, but we got a captured picture, but we didn't figure out the distance. We didn't classify, so we gathering data together now, the body composition data from the scale, and also we take a picture together.
Thank you.
Thank you. Thanks, David, for that question. Anyone else from the judges with a question? No? If not, thank you very much, Miss Faye. Thank you. All the best. Oh, I'll just take the clicker from you. Yeah, okay. All right, the next startup, she actually had to leave Singapore really quickly, so we did a video recording of a presentation. And I'm going to, we're gonna just test the sound.
Hi everyone, hi judges. My name is Valentina from Initcare, and we provide counseling management solution, API. So when I was doing my doctorate degree in psychology, I worked closely with a lot of counselors. They often face challenges with client follow-ups, and they generally spend 2/3 of their time on administrative work. And many counselors were wishing they could do more for their clients. Turns out that they were using manual and fragmented systems. They don't have access to custom tools that their centers or hospitals do. And the thing is that globally, 80% of counselors operate as small businesses. This is how our system EPI makes a difference. It's a tool that consolidates all these tasks into one platform while also enhancing client outcomes. So we provide experience that is specifically tailored to counselors' needs with the day-to-day workflows, from paperless intakes, test analysis, and progress/case notes, and risk evaluation. The key is that data-centric management solutions are already thriving in current market, and our mission is to provide data-driven insights in counseling. From our features, quantitative, semantic, and acoustic information will be combined to analyze and to provide deep insights into psychological state. Acoustic part is currently in development. In Singapore, the feature will be firstly tested in 2 different places, one for research and the other for educational purpose. So why EPI over competitors? Western markets have successful counseling management systems, but we understand the unique family dynamics in the Asian market. For example, we ensure parents feel involved throughout the whole process of their children's counseling journey. For early traction, EPI has shown remarkable statistics that prove the impact of our tool. And the traction has been steadily strong. We've scaled to approximately 2,000 users, and about 98% of our customers choose to make recurring payments. So API operates on a SaaS model with monthly and yearly recurring payments. Additionally, we generate revenue through integration fees by implementing our system's API. And we know how to execute. We're targeting small businesses through making partnerships with leading assessment companies. But API isn't just for small businesses. We've also secured contracts with 6 major universities in Korea, including Korea University, and implemented our API in a consulting firm, which would be our first case study in a corporate setting. The total market size for this product is $4 billion. Singaporean market is integrating in a way that EDR market is growing, and that there are many companies we could do API integration with. And the government is to increase the number of psychologists by 40% next few years. So right now, we've just started global expansion. For now, we've signed an MOU with sales and marketing in psychology organization. We've got 2 well-established counseling institutes to be our reference customers. We're professionals, and our expertise spans across data science and counseling. Advisors include MD of Psychiatry at Assam Medical Center and PhD in Psychology at Columbia University. We're aiming to raise $200K to further scale. Thank you, judges, for this great opportunity. If you have any questions, please reach out to VentureBlick team or drop me an email, and I'll get back to you as soon as possible.
All right, that's Valentina from Initcare. Actually, the applause should be for Marcus for holding the microphone by the speaker to make that happen. All right, moving on to our 13th startup that's pitching tonight, D and U. Where's Gion? All right, he's just walking here with a swagger. Gion Kim, up to you. Yours. Here. 4 minutes. Go.
Good evening. This is Jian Kim of DNU. We are making a Leopard, safe magnetic bicycle pedals with high pedaling efficiency. In 2022, US President Joe Biden failed while using clip pedals. Unfortunately, this is true. Even very slow speed, he fell. Because he couldn't get out from the pedals, and these porters are a similar accident, all the same. And they cannot escape from the pedals. The clipless pedals make a efficiency of pedaling or cycling, but there is a problem because it is very risky and very dangerous at emergency situation. They make serious accidents and injuries. And clipless pedals make a high pedaling efficiency, but there is a problem such as difficult to engage and disengage, and inconvenience in use, and high probability of accidents and injuries. And this is why we make a Leopard. Only use magnetic without a physical connection. This is our product, Leopard, magnetic pedals. And the solution is easy to engage and disengage because we use only magnets without a physical connection. And comfort, because magnet is move inside a cylinder, so users can use any side of the pedals, and it is safe because we use magnets. Leopard use custom-made and 52 grade neodymium magnet. It is so strong, so we ensure the binding strength, and we use patent technology for convenience and safety. And also, we use a strong and lightweight material, that is aluminum alloy materials and titanium alloy parts. And this is very important, number 6. Our Leopard designed to fit almost the bicycle and clip shoes. Clit shoes. You know, clit shoes is a bicycle shoes. So number 6 is very important. And Leopard is a lightweight, clean, and convenient because I said we use aluminum alloy frame and use titanium alloy parts. And clean, because we use a patent technology to prevent attachments of metal shavings or other dust. And it is convenient because we use a cylinder, and magnetic is inside a cylinder, and magnetic is up and down, move freely inside. The growth of the pedal market is, bicycles are gain attention at global worldwide. So bicycle pedal market is also continue to grow. Thank you so much.
Great, thank you very much, Mr. Kim. Okay. Any of our judges are cyclists here? Anyone cycles? No. Oh no. You will have a question. Not that you cycle, right?
No, I don't. I don't cycle because I'm over 50. See, so I don't. But anyway,
so young.
I saw the unit priced over $200, rather expensive. So are you targeting anybody who does bicycle, or are you only targeting the professional bikers? Because $230 seems quite expensive for normal people who want to bike. Yeah.
Yes, our rail pad is not for normal bicycle users, or for leisure cycling rider or professional. Yes. They usually they have an expensive bicycle. Yeah.
Which costs like tens of thousands of dollars already.
Yeah,
so
yeah,
in
very
comparison.
So not for someone like me, right? So.
Well, I mean, if you cycle, I don't know, you gotta start cycling first. All right. Any other questions from the judges? No? If not, give a round of applause for.
Thank you for
so
listening.
much. Yeah. Thank you. Alrighty. Okay, so second last speaker for the evening, Mia. Yes, Mia Huang from Oldham, known as well as Mia. Is that right? Yeah. Oh, all right. You've got samples. Do you want to put? Yeah. Okay. Great. Over to you. Could we give her a hand? Second last speaker of the yes. All right. Take it away.
Hello, my name is Mia, and we are Oldham, we are a consumer goods company. Today, I would like to introduce our new innovative menstrual cup for athletes and active women. So, have you ever thought about how much time women spends on the menstruating? So it starts at the age of 14 and menopause around 55. So total of 40 years of menstruating, which is a quarter of life, like spend the menstruation. But the current products are limited in two options, which is the sanitary pads and tampons. Those are not ideal for swimming, exercising, and any kind of outdoor activities. And those are need to be changed every 4 hours. And the tampon also carries the risk of TSS. So Oldham developed Korean first colored medical menstrual cup really. This one can be worn up to 12 hours, and there's no limitation with the swimming, exercising, or any kind of outdoor activities. So I would like to highlight 3 of the key points of our Freely. First is the medical colored menstrual cup, which is prevent staining. Second is a ring design. This one really helps us to remove easily. And the third is the antimarkle container. So the competitors' design are transparent like this. So this one is really easy to like staining because this one holds the blood. And second, they have a stem design like this. And this one is really hard to remove. So sometimes customers need to visit emergency room. And the third, our container, those are different from like competitors' fabric or like a plastic container without any no features. We are FDA registered and we already have like international test certified. We have a global expansion plan through e-commerce platform in like Singapore, the United States, and South Korea. We already have generating the revenue, but the existing products, like 50% in Singapore and rest of 50% in South Korea. And we are also targeting the United States market because United States market, menstrual cup itself is 400 million market. We're not a new company. We've been playing for this area like 5 years. Last year, we generated 2.5 million, and we already have a 20 plus SKU. Second, we are #1 seller in Singapore, both of the Shopee and Lazada since 2022 January. And third, we are also the #3 in Coupang, which is like a Singaporean Singapore Shopee. And we are first company funded by Korean Peruvian government. And lastly, we already have existing partnership with 14 companies across 7 countries. So this year, we are anticipating 3 million. We just opened up our pre-A. And in a couple of years, we're planning for like IPO and M&A opportunities. We already have a great team members. Everyone is expertise in like finance, marketing, R&D, IP, and investment. So we are ready to scale up. So if you guys can join us on our journey as a partner or investors. Thank you.
Thank you, Mia. All right. Any questions from our male judges about menstrual cups? No?
I'll do the doctor card.
You do the doctor, all right, yes.
No, you mentioned IP lawyers in the end. I was going to ask about what's the patent protection. I mean, from the competition between a ring and just the color. What's your edge other than that from a patent barrier point of view?
So we already still the IP, like we already secured like 45 IPs last August about our products and the current products. So that's one of our points. And do you have any more?
It's IP protected for now?
Yeah.
It is IP protected. Okay, just to confirm that. And one last question, or all good? Oh, yes. Yeah, good.
I'm just curious, the number one on Lazada is number one in terms of such a cup.
So we already have existing products. One of them is like a baby wipes. Those are the number one seller in Singapore right now. Yeah.
I see, thanks.
Thank you.
Chris? Yeah.
I was going to ask, because this is a Korean company, usually they start from the home country, but I saw the ranking Singapore number one. I guess it's pretty good, but why in Korea only number 3? Why not in Korea number 1?
Some national pride going on there.
Okay, so it's a different category actually. In Singapore, it's the wet bars, but in Korea, we are like number 3 seller as a flushable wipes. Yeah, those are the like different markets actually.
Okay, great. Thank you very much, Mia. Round of applause for her. Thanks for bringing the products as well. Okay, we have one last startup finally, and then we'll get you guys to vote for your favorite ones. Actually, it's quite interesting that we put this startup the last, because I don't know, it's getting late, not sure if you're sleepy. But here to talk about sleep hygiene, Mr. Kim, tell us about Dr. Friend. Round of applause for Mr. Kim, last speaker. Yeah, give him some love.
Cheer up, guys, the last turn. Yeah, and I'm the Yongsa Kim from DF4, and I have the sleep and healthcare brand. The brand name is Dr. Friend. Let me ask you first. So do you know what are Samsung executives they have in common? Yeah, rich. Yeah. So the first one is they have expertise in their field, and second one is they have a strong loyalty, and lastly, they all use Dr. Friend. How they use that? In the CES in this year, the one of the Samsung CEO visited the Dr. Friend booth, and I introduced the benefits of our Dr. Friend's grounding sleep and sleep and healthcare technologies to him. After returning to Korea, he bought for himself, and after 2 weeks later, he also purchased the gifts to the Samsung, the executives. So, is that lucky? Yeah, but we don't call it luck. We call it value. It's the value of waking up refreshed every morning. But recently, in reality, many people aren't getting good sleep. And someday, when they wake up, they feel tired, but it's not good and it's not wrong. So we found solutions. So we have some grounding technologies and natural materials technologies. So grounding is very simple. So you use smartphones and laptops every day, and the electromagnetic waves emitted from the laptop or the smartphone, absorbed to our body, but it's invisible, but we can feel. But there is an abundant negative charge on the earth and the ground, and we have to make some balance, electrical balance, so you can feel the freshness after you do the grounding. I'm sorry. This principle is similar to when you walk on the barefoot. So you have an experience to barefoot on the grass or the beach. So when you walk barefoot, you can feel the refreshness, and but grounding sleep is a connect to the grounding, connect to the outlet, and you can feel the grounding. So when you walk barefoot, it has some limitation. Yeah, so you invest your time and some risk in the winter or some other things. But grounding sleep is very easy. Yeah, just sleep. Yeah, just lie down and sleep. And you can feel grounding for 6 or 8 hours. So grounding sleep market is still small. And the most competitors so only focus on the grounding yoga mat or grounding very simple, the bed seat. But the doctor friend strive to make us a very comfortable and it's a very the ideal sleep environment for our health. And so we think so we can compete the global bedding market in the future. So therefore, the established last year, but actually we have 2 more companies, the Dr. Friend Manufacturing and Dr. Prestige company in Korea. And over the decade, the satisfied customers share their experience. So we have the partnership managed some online and some the sports team. So I think it's because of the word of mouth and it's the big strength to us. And more, so we have some proven effect. So the clinical research since 2018, and so we have we think is invisible, but we can feel. So we want to improve our scientific trust. So it's keep going on. And now, so I think that I want to seek the distribution partner or industry partner, sports or hospital. And so our team is here. And so what do you think? There's no reason not to try to grounding sleep every day for your health. So I really hope you have the grounding sleep every day for your health. And I really hope that you improve your health every day, just like Samsung. Okay, thank you.
Thank you. Oh, no wonder you look so good, Mr. Kim. You must have very good sleep every night. All right. Any questions for our last presenter, Chris? Yes.
I actually spoke to him yesterday about the product because I'm one of those individuals that has a huge problem with sleeping. Yeah. But there are many products out there claiming that they can help you to sleep better, but a lot of them don't actually work. Yeah. So do you have some kind of a clinical data that can prove that your product can actually help people to improve their sleeping, that in an evidence-based manner, in a medically sounding fashion? Yeah.
Yeah. So it's a very perfect question. So the like Chris, many people have some they want the research and the data of our grounding the effect. So we do the clinical trial 2018, the anti-inflammatory and stress relief and sleep quality improvement, but it's a rat the experiment. And so based on this, we have some confidence of the effect of the grounding. So in last year, last year we do clinical research to target to the insomnia patient, but it's not posted on the SCL level journals, but we complete the writing the thesis. So I think you will confirm the specific the data on the next year. So, yeah.
All right, great. Any further questions from the judges? No? All right, if not, then please give all the 15 startups a round of applause for pitching to us. Okay, right now I need a big favor from everyone in the audience to whip up your smartphones and tell us what you think about the 15 startups that pitched today. There are 2 questions there. One is about which startup impressed you the most, and the second question is if you're an investor or if you're interested in exploring investing into one of these startups, then which one would it be? Well, you can put in as many as you want. Let us know so that we can contact you after this.